which is all about and welcome to tonight's talk, which is all about foot drop and how do you treat it. Now, I'm going to talk for about 30 minutes tonight, which is actually a very short time to talk about a very complex topic. I actually delivered a 2-hour workshop on treating neurological foot drop at the Spanish Physiotherapy Conference earlier this year. So I've taken parts of that and condensed it. So hopefully give you just a much deeper understanding to the complexities, but also some really practical takeaway things from tonight that will hopefully help either your situation or someone else you know who might be struggling with that foot. I'm just going to make sure I can advance my slides. There we go. So, my name's Gilly Davy. I am the clinical lead neurological physio at Active Rehab. I did own the company Connect Neuro Physiotherapy, which some of you will know me from there. I closed Connect down late last year and started work for Active Plus so I could actually advance my clinical side even further than try and run a business at the same time. So we've got a beautiful new clinic space in Albany, in Rosedale, with lots of fantastic equipment and a really beautiful view you can see out of those lovely windows. Then we run a whole range of neuro-specific rehab, not only MS, but all of the neurological conditions we treat with quite a big team. As Nicola mentioned, I am the founder of MS Get a Head Start, which is an innovative 6-week program really looking to inspire and enable self-management of MS. And very fortunate as well that at the clinic, we are the only place in New Zealand that holds the Rex Bionics exoskeleton, which has been proven with a couple of recent research studies out of the UK to be really beneficial in MS. So we get to play with a lovely robot regularly as well. So that's a little bit more about me. So today's talk is why we're going to talk about foot drop. And I will interchange when I talk about foot drop compared to decreased ground clearance, because it's not always that common that someone's got a really flaccid, floppy foot. It's more that due to a complex situation, your foot doesn't clear the ground very well, which means that you end up catching it and tripping on it, etc. So we're going to talk about it because it is actually one of the most notable lower limb impairments after the development of a central nervous system disorder. So that decreased ground clearance, that inability to clear your foot clearly off the ground, is actually one of the most common gait problems following a neurological condition. The downside is that it can increase falls. You need a lot more energy expenditure, okay, and it reduces your endurance. So it really can make quite a dramatic limitation on your function and your quality of life. It decreases activity levels, which unfortunately that in itself accelerates decline. If we know that you are not being active and being able to get out there and walk plenty, then that's actually going to increase the decline of degenerative conditions. And it's also the largest percentage of time in physical therapy sessions is spent on gait activities. The majority of patients or clients who will come into our clinic, when we talk about goals on their very first session, majority of people will highlight that their goal is about trying to walk better. And now that might be further, that may be faster, better to someone can be quite different to someone else. So this is kind of why, foot drop or decreased ground clearance is actually a really, important fundamental topic to cover. So just interesting, just to have a little look at some of the biomechanics of when we talk about foot drop. So this is a picture of the gait cycle. So the very first top left-hand picture you see where it says initial contact. So that is once your leg has swung out in front of you, and ideally it is your heel to hit the ground first. So you'll already know, or you can start noticing if you have got any form of ground clearance issue, if you don't heel strike. So some of people may actually start with actually hitting the ground with a flat foot. So if you don't heel and rock onto your foot, if you go straight into a flat foot, we already know that there's potentially some gait abnormalities going. Because then from the initial contact, you see that we actually go into a flat foot as we rock over the middle of your foot. So the mid stance, okay, is when you are standing on that leg and the other leg is swinging. And then we go into heel off as the other leg comes through to make that initial contact. And you'll see that we go into quite a lot of plantar flexion. So that is our pushing off our toes. And then we go through the swing cycle. But I just want to highlight from the heel off, okay, we've gone into a calf raise, so our heel has come off the ground. So we're in what we call plantar flexion, so that's toes down. We stay in plantar flexion as then the knee bends and brings the leg through. And what you'll actually see in mid-swing, so this second from last picture, is that the angle at your ankle is only actually 0 degrees. So what we call that plantigrade. So that is that it's your ankles at 90 degrees. So where your shin bone is and your foot is at 90. And then as you see in the deceleration phase, that last picture, just before you get back to initial contact, the ankle is still at 0 degrees. It's just the leg has rotated as it's swung forwards. So a lot of people think foot drop is this inability to lift your toes up. So lift your toes up towards your shin. But we can see from this normative value here that we don't actually need much dorsiflexion. So dorsiflexion is that lifting those toes up to your shin. That we only need to be able to get our foot back to what we call that plantigrade, so that 90 angle, to successfully clear the ground. So what this shows us is that your ability to clear the ground is much more affected by a lot of other structures, okay, than just your ability to lift your toes up. So the definition of foot drop, and again, I say that it interchanges between foot drop or decreased ground clearance, because when we actually look at foot drop, a lot of people are looking at that floppy, flaccid foot, which can happen if you've got a lower motor neuron injury. So something outside of the brain or the spinal cord, which isn't a presentation of MS, it's a different presentation. So the definition, through the literature says that it's an abnormal dorsiflexion, so that it's an abnormal ability to lift the toes up, will affect the angle of the hip flexion and the knee flexion, creating an asymmetric gait and a decreased pace. So again, when we look at this complexity, is that just not having the ability to lift your toes up is starting to throw out other structures higher up. Another definition is that the muscle weakness of the ankle is associated with reduced plantar flexion. So that's your ability to push off your toes, and that is our ability to power forward. So if you stand and try and push up onto your tiptoes, if that is difficult, I already know that you're going to have some difficulty clearing the ground with your gait. So again, the muscle weakness of the ankle is associated with reduced plantar flexion at the end stage, so the end of stance phase, and reduced dorsiflexion in swing phase. So this definition here actually cites that it's more than just the dorsiflexors, it's the plantar flexors as well. And it's often due to weakness of the anterior calf muscle. So that's another word for our dorsiflexors. So just to recap, everyone, dorsiflexors are the muscles that are on the front of your shin that pull your toes up. So if you're sitting there now and you try and pull your toes up, that is your dorsiflexors. And if you lift your heel up and go onto your toes like a ballerina, that is your plantar flexors. That is your calf muscle. Okay. So this third definition talks again about the weakness of the front of the muscle, but it also talks about the increased tone in the posterior calf muscle. So tone is a state of tension, how much muscle tension you have. Now, there is a substantial amount of the MS population who have something called spasticity. So spasticity is that your muscle does like a cramping type of sensation, but also what it means is that it's going to be in a state of too tight and on, so it's switched on too much. So over time, what happens is that your calf muscle shortens. Now, if you've got a shortened calf muscle, then you're not going to be able to lift your toes up towards your shin very well because this calf muscle is too tight and it's going to decrease your range, which is very fundamental as we go through this talk. So foot drop is really complex. So it is different. If I start at the top of this diagram here, the presentation of foot drop or decreased ground clearance is very different if you are an upper motor neuron or a lower motor neuron injury. So MS is an upper motor neuron, so that means that the damage is within the central nervous system, so within the brain or the spinal cord. If the damage is in the lower motor neuron, that means it's on the peripheral nerves once it's left the spinal cord. So this is someone who might have had major back surgery and their peripheral nerves being damaged either through the injury or for the surgery, or there is a bunch of neurological conditions that are only peripheral based. There's a difference of how the foot drop is affected depending on obviously your strength, or in other words to say is your weakness, and whether that strength or weakness is what we call concentric, so that is the ability to shorten the muscle and put it under load. But there's also eccentric strength, which is making the muscle work while it straightens. Within MS, we have a huge issue around fatigability, which I'll talk a little bit more about towards the end of the talk. But what is really classic in an MS presentation is in the early stages where you might be having some foot drop or ground clearance, is that you can walk absolutely fine for 5 minutes, 10 minutes. For some of you, it might be 20 minutes. You might even be able to run for 30 minutes. And then your foot starts getting heavy, or you notice that you're starting to limp, or you're starting to drag or swing your leg around. And what you'll find if you stop and have a rest, that you can go again. So a classic is someone who can walk for about 10 minutes absolutely fine, but after they hit the 10-minute mark, they started to notice that that foot is just starting to catch the ground. And if they keep pushing it, then it just starts to get worse and worse, and they're just compensating more. If they sit down on a park bench and rest, and then they find that they can walk quite well again, and then as it kind of hits that 10-minute mark, they're really struggling, okay? And that is that neuromuscular fatigue, and it is quite unique to MS. You can improve it, okay, but it is something that is unfortunately a pattern that is seen with MS. We've talked briefly about spasticity on the slide before, that if that calf muscle is too tight and has a level of spasticity in, that is going to affect how effectively and efficiently your toes can actually pull up and clear the ground. And that has a knock-on effect to range of movement, okay? How much range you have in your ankle, okay, is really one of the most important things to be able to clear the ground, okay? But also your ankle stability. You know, when someone starts having difficulty clearing the ground through foot drop, it's not just often the one muscle, that shin muscle, that gets affected. Often it's quite a lot of those little muscles and all around the ankle and the foot, which can make you quite unstable as well. So often there is a few things happening that are affecting that ability to walk. It's not only your ability to clear the ground, but also your ability to stand on that leg correctly and safely while the other foot is swinging through. So hopefully what you've just about gathered from there is that it is quite complex, and there's actually a multitude of different parts of the leg from the pelvis down, so from the hip, okay, to the knee, to the ankle, to the foot, that could actually be affecting your ability to clear the ground. So again, we raise that question, is it foot drop or is it decreased ground clearance? So to really get the most effective input on what you should be doing for you if you have a foot drop issue or a ground clearance or any form of walking issue, is that you really need to have a really detailed assessment by someone who is experienced in neurological presentation. So a neurological physio, okay, is who you'd need to see. Because what a neurological physio will do a bunch of tests, and we can see that little picture there where I've got a tape measure, and I'm actually measuring calf length by that measurement there. So they do a bunch of tests to then result in what we think is the hypothesis of what is it's the main thing that could be causing your impairment, and what should be addressed first. And again, a classic example of this is I've had individuals with MS come to me who have said that they've got a foot drop issue, and they may have been given a electrical stim, something to help lift their toes up. But when we've done a thorough assessment, we actually see that their toe lifting is fine. Their problem is that they're so tight and weak in their calf muscle. It's that is affecting their gait and causing them not to be able to walk effectively. So, as I say, it is a really complex topic. And if you want to have something specifically done on how your walking is going, this is where I'm going to refer you to go and find a neurological physio who's got experience in foot drop. And to find neurological physios, you can go on to the Physiotherapy New Zealand website, so PNZ, Physiotherapy New Zealand, and you can do find a physio, and you can select your location, and you can select neurological physio, and it'll bring you up a whole list of providers that are in your area. But what I'm going to do now is kind of go through a little bit more of the treatment, so you've got a bit of an idea of some of the things that you might even be able to start with at home to see if it makes a bit of an improvement to your situation. So, treatment options, I'll just take that one out. So we're going to look at things of lengthening, so stretching, which muscle groups are important to strengthen. I'm going to very briefly touch on electrical stimulation. Electrical stimulation is actually a very lengthy topic in itself, but again, just to give you a little bit of a nugget of information about it. Proprioception and sensation is also important. There is certain things like kinesiotaping or K-taping, we call it. Things like mirror box can be useful. There's spasticity management. We can also get a lot of things like toe clawing can happen in MS. I'm going to touch briefly on about orthotics and AFO, so ankle foot orthotics. They're slightly two different things, the electrical stim and the gait training. So I'm not going to cover all of these topics in today's talk, because as I say, this is part of a much longer workshop, but I've just picked out some of the key things that I think really do make a difference for someone with MS, but also some things that you can practically maybe be starting, or even take to your own physio or exercise professional you've got to see if you can start implementing in your rehab program. So the first one is length, and I cannot stress this enough. If you've got a tight ankle, and in particular, if your calf muscle is tight, then your ability to clear the ground is going to be significantly affected. And I would be quite happy to put hand on heart and say probably 90 to 95% of the individuals that come in that I've treated who say that they've got some form of walking, gait, ground clearance, foot drop issues have a tight calf muscle. And once we stretch that calf muscle, they can start walking better. Now, the tricky thing when we're talking about stretching is we aren't talking about necessarily just stretching the muscle. We're talking about stretching all the connective tissue around the muscle. You know, you don't necessarily tighten up and lose your length overnight. Okay, the length changes that you've got that are causing that ground clearance issue have been gradually shortening over months and years. So you're going to have to do a really good stretching program for probably a good 3 to 4 months before you start really noticing the difference. So basic calf stretch, okay, you would have seen this before, and some of you have done some sports and stuff in the past. It's this kind of lunge stretch where you've got one foot behind the other, straight back leg and a bent front knee, okay? However, you can get this stretch quite wrong. So this isn't my go-to. My go-to is a calf stretch board. Now, I'd actually do this holding on. Okay, so you'd have this either next to the kitchen bench, behind a chair, behind the back of the sofa. And this is one of the best ways to stretch your ankle effectively, but also safely, without having your knees at a funny angle or your foot hanging off a step and damaging the arch of your foot. So the stretch boards that we use are about a 25-degree angle. And I would get patients standing on here for about 2 to 3 minutes. So, you know, a 30-second stretch isn't going to change your connective tissue, but standing on a board like this for 2 to 3 minutes will start to lengthen that calf muscle. So if you want to do anything, this is one of the best stretches I can recommend. You can purchase boards like this, but you can also have very handy people in your life who might be able to build one for you. As I say, the angle's a 25-degree angle. Another really important stretch is your toe flexors, and in particular your big toe, because the muscle runs from the back of the calf right down behind the ankle, under the sole of the foot and into the big toe. So it's a very long muscle. Okay, and if that gets tight up at the calf, you can really struggle to clear your toe, your big toe. So this is a really great stretch. And so you can see here, I'm sitting on my heels, but with my toes in that full flex position there. Or extended position. Now, if you are really good on your feet and you may still be running, okay, or you are a runner, they reckon you need at least 65 degrees flexion to run. So if you're wanting to keep your running going, this is also a great stretch to do. You can even just stretch your ankle here. If we see this bottom picture where we've got the back leg and that person sitting is just at the 90-degree angle. But if you slide your heel back underneath the seat, but try and keep the heel on the ground, you'll feel that even that starts to stretch your ankle. Okay, so for some of you who may be watching whose mobility is more affected, okay, and standing up stretches is difficult, you could even do some stretching and sitting. Okay. But also we do use things like heel wedges. So if you've got a really tight calf, it's going to take a long time to stretch that calf out. So we will often do things like wedge inside your shoe to just accommodate for that shortening to allow you to clear the ground better. Now, please know if you put a wedge in one shoe, you must put a wedge in the other shoe. Okay, we don't want to give you suddenly a lopsided leg discrepancy. Okay, but again, I wouldn't be advising you to be putting a wedge in until you've actually seen an expert who can advise if it's the right thing for you. The other thing to note, so this is a big resting splint that's at night, that when we sleep, we all sleep in plantar flexion. So we all sleep with our toes pointing down. Okay, so you think about how many hours you spend in bed. Probably about 8, some of you less, some of you more. So you're spending about 8 hours out of 16, out of your 24, where your leg is in a shortened position. You've got your plantar flexors are shortened. So things like night splinting and stuff can be really useful. However, it comes with a lot of issues because who really wants to sleep with a massive boot on their foot? You know, sleep is important, and we have to weigh up the issues that if you sleep with a massive boot on your foot and can't go to sleep, well, sometimes you're better off to actually go to sleep and not worry about a resting splint. So a couple more lengthening exercises here. So again, this is a demonstration of this chap using his less affected side, okay, stronger side to pull back his more affected side to give it a bit of a stretch. Okay, quads, okay, so the muscle along the front of your thighs are also a really important muscle to stretch, and you can stretch them on your side, but also lying on your stomach. Sometimes it's pretty hard to grab your ankles, so you can put something like a band around it. We've also got your hip flexor, okay, so right at the top and the front of your hip, okay, and you can stretch this by hanging your leg off over the side, over the edge of the bed or edge of the table. And we've also got a hip flexor stretch, which you can do in kneeling, okay, and then also a hamstring stretch, okay. So if you've got a particular tight muscle, we need to get the length. And again, this is why a really thorough assessment is needed, because you don't need to necessarily do lots of other stretches if the rest of the muscles are good. You want to make sure you're stretching that target muscle. So strengthening. So this is the key part. So strengthening the dorsiflexors, so those muscles along the front of your shin. Just even sitting there, heels on the ground, pulling your toes up. Now you can do that one at a time or both at a time. If your ankle's really stiff, you could even just start with it rocking. So this is on a wobble board, and we're just rocking the board forwards and backwards just to start getting some movement. My favorite exercise, if you can do the first one and lift the toes, is actually to do this TheraBand exercise, which is going to get played in a video in a moment. So we'll explain that more in a moment. Standing, you can pull the toes up towards your shins as well. Good work for balance. And even some heel walking. So walking along only on the heels, keeping your toes up. Let's say, here's a video now of my favorite go-to exercise. Dorsiflexion. Take it again. And we're going to slide it underneath your foot and over. And you want to make sure you're covering up to the little toe edge. You're then going to take the band, put it really nice and tight, and step on it with the other foot. So we've got the tightness there. Then we're going to bring the foot up, making sure it stays straight. So there should be enough put on the band that it feels like the band's trying to pull your foot in. And you've got to keep the foot out to the side and then slowly down. We're going to work on going up with speed, slowly down. Up with speed, slowly down. Doing as many reps and sets as depicted on your program, and then you can change sides. So the important thing when I was saying going up with speed and slow down, that's our different ways of working our muscles either concentrically or eccentrically. So really handy one that you can do with a TheraBand, and start with a really light band to start with because you want some movement. And that exercise also works on our everters. Now, our everters are those muscles, they're called your perineals. They're the muscles that are on the outside of your shin. Okay, so the front of your shin is your dorsiflexors, the back is your calf, and on the outside is your everters. And they're really important for balance, but also really important to get your foot flat so it doesn't end up rolling on the side. Okay, and a really easy exercise here, yeah, we can all do this together now, is you're going to sit, okay, with your feet on the ground, and I want 2 inches between your knees and your ankles. Okay, so 2 inches between your knees and your ankles, and then keeping your feet where they are, you're going to squeeze your knees and ankle bones together as depicted in the picture, and what you'll see is that the outside of your feet raise off. Okay, and that is a good little way to strengthen those everters. Another more demanding way is a TheraBand around your feet and side stepping. Now, obviously, only do this if you've got good balance. I don't want to hear anyone falling over because they've tripped themselves up with TheraBand around their feet. But this is more of a high level one. Our plantar flexors, our calf muscle. So strengthening them can start in sitting. Okay, so just going heels up and sitting. You can lean forwards and put a bit more weight on them as well to make it harder. But our classic one is standing up and going up onto your tiptoes and here behind a chair. But the big progression, you need to be able to actually do a calf raise on one leg. If you can't calf raise on one leg, then that is going to definitely show me that your plantar flexor weakness will be dramatically affecting your ability to walk and clear the ground. So again, that's a real key one. If we think that one of the first key ones was on that calf stretching board, second key one is a one leg calf raise, and that third key one was the video that I just showed you. We can do tiptoe walking as a progression. We can do jumping, bounding from side to side, and even get into things like skipping and much more high activity ones. Sometimes our hip flexors can be very weak in NS, which again will affect your ability to clear the ground. So it's not your foot drop, but it's ground clearance. Okay, and again, at the complexity of what the definition is. So on your knees, walking forwards on your knees is a great hip strengthener. Also doing some step ups with bringing that knee up nice and high. And you don't even need to do that on a step. You could just do marching on the spot. And another quite advanced one is our mountain climbers. So in that high plank position and bringing one knee up towards your elbows and back down. So just touching on this neuromuscular fatigue. So I'm just going to have a quick trick. Again, it's quite a complex topic that I won't have time to go into today, but there is a statistical reason of why in NS you end up with weak and floppy muscles after doing exercise or continuously trying to move, is that you just get what we call this neuromuscular fatigue. So if you're going to do some strengthening, or some gait training, if you want to try and improve your walking, you need to do it in intervals. Okay, so if you're going to work on walking, rather than trying to go for a walk for as long as you can and end up dragging yourself around and not enjoying it, you're better off to walk at pace for a short distance. So that might be for a minute or 2 minutes, okay, or it might be 50 meters, something that you can do well, and then you're going to sit down and stop. And then you're going to do that same distance, trying to go as fast as you can and sit down and stop. So there's some really good research which looked at doing a 6-minute walk test, and it took 2 groups of patients with MS. And one group, they trained for 6 weeks doing 2-minute intervals, and they did something like 10 2-minute intervals. So it's 20 minutes of walking, but they only ever walked for 2 minutes, and then they stopped and had a rest. And then the other group tried to walk continuously for the 20 minutes. And what they showed at the end of the 6 weeks, it was actually the interval-based group were able to walk further, faster, continuously, compared to the actual continuous group. So we know interval training has a much more positive effect on MS. And when you come to your strength training, you know, there's that good old classic, you know, physio prescription of 10 reps 3 times. But what we found with MS is that you're better off to load up the weights and make the exercise as challenging as you can from a strengthening point of view, but only do 5 reps, but do 4 to 6 sets. So you still will potentially be doing 30 reps overall, but what you're doing is a heavier load and a shorter amount of reps with a bigger rest break. It means you're going to get much more physiological change regarding your muscle strength. And they reckon that the exercise to rest ratio, so if you were doing a 2-minute walk, is that you need about a 2-minute rest before you go again, okay? And if you were doing your 5 reps of, let's say, your single leg calf raise, and that took you about 20 seconds, well, then you'd have 20 seconds rest before you do it again. So just a couple of extra little tidbits about managing ground clearance foot drop issues with MS is a lot of individuals with MS will have a hypersensitivity of the sole. And I generally test this by grabbing hold of your foot and digging my thumbs in and see if you leap off the bed. And most people do. But no, what we do seriously is get you to do a bit of desensitization by rolling something like a golf ball. A tennis ball is actually a little bit too kind, but rolling a golf ball underneath your foot and finding the sore spots and desensitizing them can actually really improve your foot function. Now, orthotics. So first of all, I'm talking about inner soles. Okay, if we look at the left-hand picture here, we can see that the left Achilles, so that tendon at the back of their foot, looks quite straight. And then we look at the right and they just look, it looks very different to the left. Okay, so your feet are your foundations. So if your foundations are a bit wonky, then it is going to affect your ankles, your knees, your hips, and the rest of your body upwards. So going along to see a podiatrist or an orthotist to get some inner soles made to put you in an optimal position. Because, you know, life is difficult when you have MS, and if we can make as many little things optimal, it is all going to add up. Now, AFOs, ankle foot orthosis, are a very complex subject. And as I say, I'm already kind of gone over my 30 minutes. I do like to chat. So I'm just going to touch on this just to give you an idea about orthotics. This talk is definitely not going to cover the real in-depth that you often need to know. But we start with something very basic. Now, this is called a dictus band or a foot up. Okay, so an ankle foot orthosis is something that's going to help your foot clear the ground. So this is a leather strap around your ankle and then can connect down into your laces either by some metal clips, or that one's got a little leather clip. Okay, and it's got an elastic band. And what it purely does is that once you've gone into toe off and pushed yourself off your foot, the elastic band just pings up and helps your foot clear the ground. It is very good for fatigable foot drops. So someone who is walking 10, 20 minutes, fine, but after that 10 or 20 minutes, then their foot starts to catch the ground. This is ideal. You just put it on for that point, and then when you're just walking your short distances, you don't wear it. Now, it only helps your foot clear the ground. It doesn't give you any ankle stability. So I do see a lot of people wearing these who it doesn't actually give them quite enough stability. So moving forwards then, we have these beautiful things now called carbon AFOs. So if you've got a plastic white AFO, they're really good for diagnostics and in the short term, but they're giving you no real structure or energy return. And Ministry of Health are definitely funding carbon AFOs. So if you've been to a Ministry of Health orthotist and you've been supplied with a plastic one, you are absolutely in your rights to go back and ask to try a carbon one, because they can definitely be better. However, they're not just a bog standard put off the shelf, put in your shoe and off you go. A lot of them need quite a bit of tuning. Okay, you might need heel wedge with them, and they might need balancing out a bit. So you may need to see your orthotist a couple of times, okay, or even 4 or 5 times. So if you are given one, do make sure that you're booked in for a review to 1 or 2 weeks later so you can have it tuned. Okay. And then we can get really fancy ones. This is called a Turbo Med, which is a very solid AFO that fits on the outside of your shoe, whereas the carbon one on the middle there actually slips inside. So it slips inside, quite slimlined, you know, not very obvious. This big one on the outside is fantastic if you need a lot of support, and you're going to do things like the picture shows here is some hiking and some really robust stuff. Now, a lot of people would look at these types of devices and get a bit put off because they'll think, oh, you know, if I need one of those, I'm going to come reliant on it. Now, if you are struggling to walk because your foot is catching the ground and you're at risk of falling, you are going to not be walking as far as if you could if your foot cleared the ground successfully. So the way that I talk about AFOs is I talk as them as an enabler. Okay, they enable you to walk more, walk further, and keep your activity and your independence higher. Okay, so if you've got a health professional who recommends this to you and you're a bit like, oh, do I need it now? Definitely try it, because if it means that you can walk twice as far, well, then you're going to get twice as many benefits from your walking. What also works very well in the NS population, which is a little controversy because it doesn't necessarily work that well in other neurological conditions, but is our electrical stim. Okay, so just like how those orthotics on the screen before help you clear your foot, so do these. Okay, so the way that these work is that they'll have like either a little heel sensor or something in this cuff, and the cuff fits just below your knee. And what happens, it sends a small electric current, okay, feels like a bit of a strong pins and needles sensation, to activate those muscles on your shin to work, to lift your toes up, to clear the ground. As I say, for the right person, they can be really, really good. Because they're quite high tech, they're not necessarily cheap. So I will just go back, give you some ideas actually. The Dictus band, so the far left, the rubber band, you're looking between $150 to about $200. The carbon is about $1,000, and the Turbo Med is about the same. Now, all 3 of those can be and are being supplied by Ministry of Health. Okay, so you don't actually need to be out of pocket for any of those, but if you do end up wanting to look at something privately. When we come to the electrical stim, the XFT, which is imported into this country and distributed by Rope Neuro Rehab, based in Mount Eden in Auckland. I think, and haven't checked it with them recently, but that's about the $2.5, you know, somewhere between $2,000 to $3,000, so $2.500 to $3,000. And the Bioness, which is on the right hand side, retails more around the $10,000 mark. Okay. So take home messages. Foot drop, hopefully, as you've seen from today, is really complex and often should actually be termed as decreased ground clearance, because it's not just the foot dropping that is the issue. You do need to have an expert assessment so you can actually find out what is your issue that you need to work on to get best results. There is a lot that can be done to improve your foot drop, both with rehab and assisted devices. So it's absolutely imperative, as our aim is to get you walking better, safer, further, faster to improve that quality of life. So enabling you to walk more is paramount for overall wellness. So that is our little thing on foot drop. So thank you so much, everyone, for listening. And I will open us up out to questions from Nicola.
Thanks, Gilly. That was fascinating, really wonderful presentation. Thank you. Please, if you have a question, just type it into the Q&A box to read out to Gilly. I have one question to start with, and that is, does increasing calf strength assist spasticity?
Yeah, so there's been a lot of debate over the years about what helps and what doesn't help spasticity. And people used to be a bit scared of strength training spasticity, but it's been well shown now that actually strength training can improve your spasticity. So if you've got a tight calf and it is got spasticity, you are not going to make it worse. You are going to make it better from strengthening and lengthening it.
Thank you. Are there any other questions? Anybody?
Hopefully I haven't stunned you all to silence on the complexity of the subject.
Here's one. Is thigh fatigue also a cause for foot drag or foot drop? Can it be improved?
Sorry, is what fatigue?
Thigh
fatigue. Yes, absolutely, because you know, when we talk about foot drop, we're talking about that decreased ground clearance, but it can be quite complex from where it's coming from. So if your thigh is what is fatiguing first, then the first thing that we would look at is ask why your thigh. Now, is that because there's other muscles that aren't working? So for an example, is that your calf muscle isn't working and isn't strong enough, so you are using your thigh muscle too much, so then that one fatigues quickly. So absolutely, when it comes to, as I say, what we kind of define as foot drop, what we really mean is anything that is causing you to not be able to clear the ground effectively. And sometimes, though it feels like your thigh might be fatiguing, what we need to explore, is it your thigh that is the problem, or is that the result of something else that's causing that problem? And a quick test that you can do is that if you are able to stand and holding on to a support surface, can you stand on one leg and do that same amount of calf raises on both sides? So what you'll find is someone could do, you know, 10 or 15 calf raises really well on their less affected side, and then their more affected side, you might find you can only do 5. And then that's a really quick way to showing you that your thigh fatigue is actually coming from a weak calf.
Could you say something about toe clawing, please?
Oh, toe clawing. So toe clawing is a really interesting one. So it happens for a few reasons. First of all, if you are standing still and you're just balancing and your toes are clawing, it generally means that you are literally trying to grip, you are trying to hang on to the ground, which shows us that your balance isn't as good as it could be. So if you are well balanced, what you would actually have is you'd have about 60% of your body weight for your heel, 40% through the ball of your foot, and not really any weight for your toes, that they should be nice and soft. So if you are gripping the ground, the first thing we actually see there is a balance issue. Now, balance is quite complex. So balance could either be from sensation, so if you've got numbness or a change in sensation in that foot or ankle, but also your ankle strength and your leg strength, that could also be causing you to grip the ground if that is too weak. But also our balance is highly affected by our vision and significantly in MS is our vestibular system. So that's our inner ear. So if the vestibular system, the inner ear balance has been affected, which it can commonly be in MS, that is again going to throw our balance center out, and that's going to cause those toes to claw. So what we need to do is try and explore what parts of your balance can we improve so those toes don't need to claw. So that's an example if your toe clawing is a compensation from something else up the chain being affected. The other things that can cause toe clawing is spasticity, that muscle tightening, okay, because of that spasticity. And then sometimes in MS, you can get also potentially a bit of an element of what can be called like a dystonia. So that's where the toes are just curled up and gripping in, and they're just being held there, and it's incredibly hard to get them out. So if that's the case, we'd look at, again, what can we do regarding stretches, okay, to lengthen out that calf and lengthen out those toes and that foot. And that might not just be stretches, it might be some actual deep tissue massage, okay, and lengthening there. We'd also look at some spasticity management, which is, there's quite a lot of different things we can try with spasticity management. But the other things that can be really good is if you've got toes that are quite stuck and, you know, they get stuck underneath when you're trying to walk, is you can get some really nice little gel pads just from the pharmacist that slip around your toe and just have like a little barrier under your toe just to stop a little bit of that gripping. Can also make a bit of a difference. But like with a lot of things, we'll often see a sign like the toe clawing, and we need to get out our, you know, our investigative magnifying glass to see what's really causing it.
Thanks, Gilly. I think that looks like all of the questions for tonight. So on behalf of everybody who's attending, thank you so much, and thank you also to everybody who's taken time out of their evening to join in our webinar this evening. Thanks again, Gilly Davy from Active Plus, and we'll see you all again. Have a lovely night, everybody. And people are saying thank you very much.
Thank you.
Okay. Good night.